It was a sight to behold as divisional and sub-chiefs from the Kasina-Nankana district, Busa and its environs, joined the Navropio for a Durbar of chiefs organized by the Navrongo Health Research Centre, Nhrc. Being the first Durbar for 2023, the chiefs could not hide their joy and expectations from the management of the centre. They pledged their commitments and asked for more engagements.
Let me use this opportunity today to disclose to the Navrongo Health Research Centre the general feeling of the people of this area for the centre. Since its inception, over 30 years ago, the people have shown a lot of respect and satisfaction for the work of this center. This feeling was confirmed to me when I paid the surprise visits to these three sub-chiefs. I'd like to share with you an extraction from the report on the discussions I had with one of my sub-chiefs during one of these visits. And I quote, when he was asked about the works of the Navrongo Health Research Centre, the sub-chief had nothing negative to talk about but praise. He referred to the Nhrc as vast and said the community owes vast a lot because of the tremendous assistance the community has been receiving from them. He talked about how the vast people involve them before the inception of any project they intend to bring to them by telling them about it before it even starts. He said the work of the research center has brought a lot of health relief to him and his people. And he cited several examples, including the CHIPS idea, where they now have nurses close to them to take care of their basic health needs.
The Busa Traditional Council appreciates all the activities by the Navrongo Health Research Centre. The benefits are vast and has brought great help and development to the Busa traditional area. We as a people and chiefs and queen mothers are ready to continue to support the program. We shall make ourselves available to support the program by making ourselves available to make sure you succeed.
I finished school at the time the center was here, and it was only at this center that you can get a job. You can't get any job anywhere. So it was this center which helped me to remain in my department up to retirement without running to Nigeria or any other place. Well, all professionals were running to Nigeria at that time because Ghana was hot by then. That was before and after the revolution. So apart from the center chocolate successes of introducing cheese compound, and then right now hearing that they are helping to shape government policy. They are also helping to retain doctors in this Kasina-Nankana district.
We've been fighting a lot to have an American assistant, but all to no avail. So I would like to deal with the research director, who is my good friend, who also have a look into it. And the research chips campus that have been in my area. In fact, they lack this kind of, I think somebody even mentioned of it, lack of drugs. I have my assemblyman here, one of my assemblymen here. He can testify to that. So I thank you so much. But if you want to talk about this in the Navrongo Health Research Centre, we'll talk, and then they will bring us here. So a word to a wise is not in the north, but it's enough. Thank you so much.
This year's Durbar was to explain the works of the centre to the chiefs and solicit their support to strengthen research work at the centre. Though project heads hold community Durbars whenever there is a new project, this platform, according to the director, Dr. Patrick Ansah, is a bigger opportunity to meet with the landlords of the Kasina district and its environs.
We are very grateful to the people of Kasina and now the people of the Busa district who have accepted us and given us a place to put our tables and chairs to work, and also supporting us with people who understand the research we do and participate gracefully in this endeavor. As a center, we have a director supported by 6 other management members, the heads of departments of the social science department, the data science department, the clinical science department, and biomedical science. Data science, they deal with computers and a lot of figures we would not like to see at this moment. We have the social science department who help us to understand human behavior and what is affecting the things that we've seen to work, that we've implemented. Sometimes you may give a vaccine, like what we do here, and the vaccine will work very well. But you ask yourself, you deploy it into the community, to the country, and nobody takes the vaccine. Why? This is why the social science department supports with all their expertise to get people to understand why certain things are being done and why they must participate to make it successful. We have the clinical science who do the what we call the hard science on human beings. They try to look at the body that we have, what sicknesses affect us, study the patterns of the sickness, study where and when and how the disease affects us, and brings about solutions as to how we can control them. Sometimes this includes drugs, sometimes it includes vaccines, other times it includes just changing certain systems to make sure that these diseases don't eliminate us.
We are comparing how they get malaria, how severe the malaria is, and the diseases that I talked about, how they occur, so that we will know whether this malaria vaccine is safe enough for use in our population and also in Africa and other places where it can be used. And we are happy to say that so far the data shows that the vaccine is very safe and it's also effective. And when it is combined with the other malaria measures, it works very well. And it is because of this that WHO has given the go-ahead that this vaccine should be scaled up and used in all the malaria areas. Then we also have the sickle cell study. We ventured into sickle cell last year because we noticed that this is an area that is usually ignored, and we got partners to partner us in this. So it was to see whether we can screen newborns, tell whether somebody has a sickle cell disease at birth, so that we can give them comprehensive care. We can take care of them and prevent all the complications that come with sickle cell disease. And because of this, there was a device that is being piloted in the various health centers and CHIPS compounds, in some of them where deliveries take place, so that we can pick up cases of sickle cell when they are very small and then prevent complications.
We have a vector surveillance project. You know, most diseases are caused, apart from the non-communicable diseases, are caused by vectors. Vectors, especially insects, mosquitoes. People don't know, but ticks, after mosquitoes, ticks are next carriers of many viruses. So we are doing a surveillance. For the past 4 years, we have been doing a surveillance where we go into the communities to sample ticks, mosquitoes, the different type of mosquitoes. You know, because we're always talking about malaria too, we did not think about the other mosquitoes that are carrying viruses. But in recent times, there are reports of yellow fever and dengue fever in Ghana. Another type of mosquito carries the yellow fever, dengue, Zika. We never even know whether we are going to get Zika reports in Ghana. So we are doing a surveillance where we pick these mosquitoes and ticks, bring them to the lab, and then we try to extract the viruses and the bacteria that are in them. And if we find any of the viruses or the bacteria that can cause an epidemic like dengue or yellow fever, we immediately have to alert the health authorities.
But one of the key things that people used to use to classify children as spirit children was the fact that those children fall sick a lot. So you give birth, the child is always sick. The child is always sick. I mean, you give them all the medications that a normal child will take, yet that child is sick. So because we do not understand why that is the case, we have to find a local explanation for it. And so we tend to call those particular children spirit children, or chichuru, or sisirgu, when in natural fact, they are normal children, but because of some traits that their parents have, they've also inherited those traits. And so that child will go, and when another child is born and the child exhibits the same thing, you say that that child has been reborn. When in natural fact, you, the parents, are the ones who are making the children exhibit those kind of things. And so these are some of the studies that are helping us to gain a better understanding of what exactly is happening within the within our population, and then we think that the community members should also know, so that when these things occur, you don't really associate them with some of these negative practices that are not good for our health.
But for the Navrongo Health Research Centre, healthcare services would have been a challenge for the people of Kasina district. Navropio was full of praise for the centre.
If the centre had not been here, I don't know what my people have done in terms of health-wise. They've done tremendously well for the people of Navrongo. You could hear from all the chiefs where they were praising the centre. When it comes to research, I think Navrongo Health Research Centre has done well, because tests that are supposed to be done at the Nibu Center in Legon, Nibuji Center in Legon, they can equally do it in Navrongo here. So I think it is a plus for the region and the country as a whole. I'm only praying that there will be a vessel from this center that will serve the whole of Ghana and the world at large.
The last time a similar engagement was held at the centre was in 2021. Leadership of the centre plans to hold these Durbars of Chiefs once every year, and to sustain it to help strengthen the bond, commitment and support between the chiefs and the people of Kasina and its environs. The Navrongo Health Research Centre, Nhrc, started as a field station in 1988 to investigate the impact of vitamin A supplementation for children in the Kasina district. It is now a force to reckon with when it comes to health research in the Upper East region and the country as a whole. It is the first health research center under the Research and Development Division of the Ghana Health Service, which continues to work with other 2 research centers, Kintampo and the Dodowa Health Research Centers, in the middle and southern belt of Ghana.